Hi, everyone. Welcome to another Rams Fast 15. I'm Dr. Daniel Jourdan, SAM Rams Board, and I'll be your host. This presentation is designed to give you critical content you need in 15 minutes flat. Today's goal is to provide information to help you navigate other career opportunities as you enter the job market. Today's presentation is hosted by SAM, Rams, and the SAM Industry Advisory Council. Members of SAM Industry Advisory Council are Atlantic Pension Planning, American Physician Partners, BioFire Diagnostics, Integrative Emergency Services, Integrated Wealth Care, and Envision Physician Services. I encourage you to visit IAC member websites for additional information on physician wellness and support for emergency medicine practitioners. The clock is ticking, so let's jump right in. I'd like to introduce our speaker, Dr. Alan Wright, the Vice President of Medical Affairs for North America at Biomerics. The key topics that we'll be discussing today are Dr. Wright's career path, why emergency medicine physicians, what does business think of physicians, how to break in, reflect and cast the net broadly, business is different. Dr. Wright, if you'd like to add any comments.
Thank you. And what I think will come out in my comments today are how to transition into one of those alternative careers. And what you'll discover is that it is not a sudden change of career path, but it's very incremental, very gradual, and it's how do we continue to build skills, attributes, and eventually make that transition into non-traditional.
Some key topics about Dr. Wright's career are going to be emergency medicine, primary care and consultant, practice site leader, HMO medical director, health insurance medical director, pharmacy benefit medical director, small pharma company CEO, and CMO of a biotech. Dr. Wright, if you'd like to talk about your career.
Sure. So I began in emergency medicine, and I think there are characteristics of the practice of emergency medicine that make that type of physician really well equipped for non-traditional careers in medicine. It is we're comfortable with uncertainty. In fact, one might say that most of emergency medicine is the practice of uncertainty. We need to collaborate with a wide variety of people, and with that background, it enabled me to transition from emergency medicine into my initial role, which was actually a primary care practitioner and a office site leader for a staff model HMO. And there I learned some early parts of leadership and how to lead physicians specifically and how to lead others in that practice. That grew eventually to becoming medical director for that HMO, which then I transitioned into a larger role within the insurance industry. All of these are evolving within the insurance industry. And then that transitioned into pharmacy benefit manager, which is again a take on the insurance industry, but it's the drug cards that we all carry that pay for your pharmacy benefit. And then finally, with my connections with the pharmaceutical industry, I founded a small pharmaceutical company with some colleagues from the pharmaceutical industry. And we eventually managed to sell that to another pharmaceutical company. And then finally, based on that and based on the skill sets with that, I was recruited to a much larger biotech company, returning to my physician leadership roots and becoming chief medical officer of that large biotech.
Wow, that's quite the career. So next, I think it's important to touch on why emergency physicians are good for this. They're comfortable with uncertainty, they have an inclination to action, they have humility, and they have a broad medical knowledge. Dr. Wright, if you'd like to comment.
Yeah, and I touched on this in my earlier comments, but one of the things that we'll discover or is required in industry is that there typically is not a broad portfolio of specialists available, and emergency medicine permits the physician to touch, frankly, just about every specialty. In the practice of emergency medicine, we see every specialty. There's some roles in these non-traditional careers, specifically in the insurance industry. I can imagine in the consulting industry, where the our business colleagues look to the medical managers in that business to have that broad medical knowledge. Additionally, there is a need for humility, and I can reflect back on my emergency room days. I was given ample opportunity to be humble. As you know, we rarely are the experts in any specialty, yet we need to practice in all specialties. And who hasn't had that situation where you've just saved a life and then the specialist comes rolling in and tells you that you've done something less than perfectly. And that background and understanding and keeping your eye on the ball, that it's about saving lives and helping patients, translates really nicely to business, where you keep your eye on the ball and manage to help the business. And finally, the inclination to action, certainly that's prized in business, and the ability to put a plan together and put it swiftly in motion is certainly an important attribute.
Certainly relate to that. Now we talk about what businesses' thoughts are on physicians. Will this person go screaming off into the night? Are they very narrow? Will they be high maintenance? What can they do?
Well, this is an important slide because these are some of the biases and attributes that are assumed of physicians that must be over by a particular physician when you try to transition into business. It is unfortunately pretty common where somebody will be hired into a business, work in that business for several months, and then just decide that business is not for them, and they will leave abruptly. And it could be things like the profit motive of grades on people, or the fact that there is a plan and you have to stick to a plan and execute. You can't explore your individual interests. But it's important to remember when you're interviewing for these roles that is an attribute that you need to show to any potential employer, is that you're stable, you're committed to this alternative career, and you won't waste their time, and frankly, you won't waste your time by a career misfire. The other thing that's important when you're being interviewed is to show that you have a broad understanding, not only with medicine, but of business. Now, it's understood that you're not an MBA and that you don't know, the details of financial accounting, but the fact that you understand business, that you understand budgets,